Hello again, everyone. My name is Marty Guthmiller, CEO, Orange City Area Health System, bringing you another edition of Insights. Again, joining me today is Dr. Dan Locker. Today's subject is colonoscopies, our favorite subject, right?
Yes.
So in doing our research, I learned some things that I really, quite honestly, wasn't aware of. 4 out of every 100 people in their lifetime will be diagnosed with colon cancer. In 2022, 52,580 estimated deaths from colon cancer, which represents 8.6% of total cancer deaths in the United States. Of the cancers that affect men and women, colon cancer is the second leading cancer in that group. So obviously, screening is an important tool and an important step in one's health. Could you talk a little bit about some of the new guidelines that are out for colon cancer?
Yeah, so unfortunately, in addition to those stats, colon cancer has also been occurring earlier in Americans, probably due to our diet. But because of that, they are recommending that people get screened at 45 years old instead of the traditional, 50-year-old get your colonoscopy. It's now 45. So that's the biggest recent change. They're doing a few things with on our end of polyp size and that kind of stuff.
So the 45, it used to be
50.
50.
So now it's 5 years earlier.
Okay.
To try to catch these earlier cancers that we're noticing.
And we have noticed that in some of our volumes that 45-year-olds have been paying attention to that and have been, and I'm sure that helps from our family practice doctors too. And
they've done a great job of that. So.
Okay. What are some risk factors that people have to be aware of or maybe even look for?
Yeah. So family history is a very strong one. So if you have a first-degree relative of cancer, with colon cancer specifically, you should be definitely getting screened for that. If they got it when they were young, so say they got it when they were 50, you should get that 10 years before they got it. So you should be getting it even earlier than 45 at 40. That's a hypothetical situation, obviously. So that's one risk factor. Smoking's another big risk factor. Just kind of more or less eating an American diet. So you're not eating lots of fruits and vegetables and healthy foods, but eating a lot of processed foods is a risk factor. And then people that have inflammatory bowel disease are at a much greater risk of colon cancer as well.
Okay, so I'm not going to stop elk hunting.
No.
Okay, I'm gonna still eat the red meat from elk. All right.
Yeah.
Okay. So you talk about colonoscopies, and people are kind of hesitant to get it scheduled to go through with it. It's kind of a big deal, they think. What would your reaction be to that?
Yeah, I get where they're coming from, but I cannot tell you the number of people I go in the morning and be like, hey, how'd the prep go? And they're like, it wasn't as bad as I thought it would be. So oftentimes it is, I'll be honest, it's a little bit inconvenient having to drink all that fluid and having to go to the bathroom a bunch. But in my opinion, it's much less of an inconvenience than it is actually having a cancer or having something major occur because you pushed it back. Getting a scope in the grand scheme of things it's one day out of 365, and you only do it once every between 3 to 10 years, depending on what your risk factors are.
Well, and because I'm almost 400 years old, I've had a few colonoscopies in my life, and the first thing that I would say is like, well, that's it. It's over. You go to sleep. You're asleep during this process. You wake up, so like, wow. But the best thing of colonoscopies here at Orange City Area Health System is that Jane McGinnis makes your toast.
Yes.
And she makes the best peanut butter and jelly toast after colonoscopy that anybody could possibly have.
Yeah.
A world-renowned peanut butter and jelly maker. So
absolutely.
Thank you, Jane. And then, of course, you get the award-winning care of our surgical team in colonoscopies. That they take great care of you. And a lot of times I hear the reaction, well, this wasn't a big deal.
Right.
I thought it was, but especially when you top it off with peanut butter and jelly, it's a good thing. So any last comments on colon? How do you get a colonoscopy? How do you go about scheduling one?
Yeah, so talk to your family practice doctor about it. They know the guidelines and that kind of stuff, and they'll refer you to one of the general surgeons here to get it done. The advantage of getting it done here versus a larger institution is that we can often get it done within a few weeks rather than.
Yeah, I mean, that's crazy, right? I mean, we're hearing some things about 6-month waits in some of the larger institutions for this.
At least.
And, that's nuts.
Yeah. Especially if you think you have a real problem, then you need to wait 6 months. That's not fun.
Right. And with the convenience of being local and the prep and all that kind of stuff, all the more reason to get it scheduled.
Absolutely.
So 1-800 call Northwest Surgery. But in all seriousness, calling our clinic at 737-2000 is probably the first place to start with that. Talk to one of your family providers. They can get you hooked up. And I think that's it. Any last comments on colonoscopies for today?
No, I mean, they're by far the most effective screening for colon cancers. I mean, you can get the little box kits where they test DNA and that kind of stuff, but there's a lot of false positive with those, and then you end up getting a colonoscopy anyways. And so with colonoscopy, we can find polyps, and then we can remove them and remove that cancer risk for you.
Great. Well, thanks for joining us again. We really appreciate that. And thank you for joining us on this edition of Insights.